Data from the Oklahoma Department of Corrections suggests about 25% of the people released from prison will eventually wind up back behind bars. And they also stand a greater chance of becoming homeless when they are released. In this week's in-depth conversation, moderator Jason Doyle discovers the reasons why and what's being done to prevent it from happening.
Thanks, Rich. Our guests for this week's In-Depth segment are Dan Strawn with the Homeless Alliance and Justin Wolf. He's the Director of Communications and Government Relations with the Oklahoma Department of Corrections. Gentlemen, thank you so much for joining us this week.
Happy to be here.
Glad to be here. Thanks.
So let's talk a little bit about the issue of how homelessness and incarceration are linked. It seems like there's some kind of adverse relationship that goes on between those two segments of society.
Oklahoma City, on any given night, about 1,600 homeless people. Of those, about 600 are unsheltered. And we survey that population with some frequency to try to figure out how we can move them into housing more quickly. And one of the things that we have found is more than a third, 37% of our unsheltered homeless, now that's, again, a minority of the total homeless population, report becoming homeless within a year of leaving jail or prison. And part of it is the things that we all know, that some employers are not willing to employ people with a criminal record, and maybe when you went in, you were living with your mom, and when you came out, mom's no longer interested in you staying with her. And, maybe you were on mental health meds while you were in, but then when you came out, you weren't able to connect to appropriate mental health care. And so your mental health deteriorated in that year. So just a lot of barriers. I don't want to leave the impression that a significant portion of Oklahoma City's homeless population has a serious criminal record, but it can be a barrier to people sustaining housing or getting back into housing.
So, Justin, do you find that in your study that there seems to be a link between those who are leaving incarceration and homelessness?
Part of the challenge when people leave incarceration within the state of Oklahoma is once they discharge their sentence as ordered by the district court, the Department of Corrections has no more authority to hold a person or ask them to be responsible or communicate with us in any way. And so we are very good at capturing information for people who choose to engage with us and engage with the process. However, there are individuals out there for a number of reasons who choose not to do so. And unless those persons are on supervised probation through the Department of Corrections, we really don't have a means to require them to engage. And that's one of the challenges that we're aware we're going to be facing. So one of our mantras at the Department of Corrections, especially through our reentry and our programmatic services, is to begin with the end in mind. So every inmate who walks through the doors of the Department of Corrections has a survey done, an assessment of their various needs that they're going to have, whether they be social, addiction-related needs, educational needs, or job needs. And we do our best at the Department of Corrections to meet those needs while they're in our custody. Unfortunately, we don't get to base their length of stay on their level of needs. And so that's controlled by the district courts, which is usually a function of the crime that was committed, that they were convicted of, or the strength of the evidence against them on that case. And so our goal is to try and meet all of those needs before that person needs to be reentered into society, and then to assist them make that transition successfully, again, within the bounds of what we can require or ask them to do.
So what kind of issues are they facing as they start to get ready to leave incarceration and for all intents and purposes, go out on the street?
One thing that we try to maintain at all times is a continuum of care on any of those needs that we just discussed. So whether it's connecting someone to a local AA or NA group, or helping connect them to their local probation and parole officer before they leave so that they have a relationship established, or just establishing the educational and job skills needs they're going to have to connect up and back into society and get a job going on their way out. All those are critical, and all those are something that our case managers are working on from the moment that a person is admitted into a particular facility. Another great example of a challenge that anybody can face is getting your driver's license removed. Everybody has gone to the DMV and had some day of trying to line up all your documents to get a driver's license updated or your tag or things like that. All the more so for our inmate population, whose lifestyles before prison usually aren't conducive to maintaining a vital records folder. And so one of the things that we do while they're in our custody is establish whether or not they're legally licensed and able to get a form of identification or a driver's license. And then our case managers work to establish those documents while they're in our care. And every inmate upon release is given a folder of all their legal documents that we've been able to obtain during their incarceration. And we always aim to have a birth certificate, a social security card, and either a driver's license or state ID upon their exit from our custody.
So Dan, do we have a good estimate of how much of our homeless population seems to be caught in that recidivism circle and returning to prison?
We don't have great data, but between municipal courts and the district court system and the state Department of Corrections system and the city county jail, it's about 30% of the total homeless population. It's a barrier for them. Outstanding warrants for unpaid tickets and those sorts of things that are handled really more at the municipal court level. Even those can be a barrier for people. Justin's absolutely right. It used to be the work of a day or two to get a person state ID, but post 9/11, that stretched out to 30, 45 days and cost $75 once you get all in. And boy, when real ID becomes a real thing, that's going to be that much harder. And so Justin's point about beginning planning for discharge when they walk in the door is critical, because coming out of prison without ID or without your kind of social network in place, including housing, can be a real barrier for folks.
So has COVID played a role, the pandemic played a role into kind of fueling the cycle?
Well, COVID has kind of impacted pretty much every aspect of the work that we do. Of course, the Department of Corrections and the city county jail both accelerated releases in order to get censuses down to avoid exposure. And so that hard work that Department of Corrections discharge planners do to get people ready, Justin's absolutely right. Once the court says that guy's done, you don't get to hold them. You don't get to say, well, I just need 5 more days to get his Social Security back up. That's not an option. They got to go. And if once they go, they're not re-engaging, then it can be super challenging.
So this question will be for both of you. How does transitional housing play a role in between the connection of trying to keep somebody from becoming homeless after they leave incarceration?
We used to have in Oklahoma City some kind of halfway houses. That sort of big operation has, we're seeing less and less in that, and more of people being discharged. A substantial hunk of the people who are in prison or jail have substance use issues. And so getting them into qualified sober living places like an Oxford House can be a really positive step to sustainable independence later on. But it can be really important to address those addiction and other mental health issues in some kind of intermediate step. Justin probably knows way more about that than I do.
Well, I was going to say, the mental health needs are a great example of a challenge that faces, anybody who has a mental health issue that they need to have addressed. Maintaining med compliance and maintaining a healthy mental state is a challenge just as much as it is to maintain a healthy physical state. So one of the programs that we've started at the Department of Corrections in coordination with the Department of Mental Health and Substance Abuse Services is called the Ricketts Program, where we've identified individuals in our custody who have significant mental health needs and the Department of Mental Health starts connecting them to the services that they're going to need while they're still in our custody. And so that way they can maintain that continuum of mental health care on the outside. When inmates are engaged in the Ricketts program, we see an increase of voluntary outpatient services on the outside, a decrease of involuntary commitments, an increase in med compliance. It's just all the numbers go in the right direction, and it's a wonderful program. The challenge is, of course, replicating that for all of our inmates' mental health needs with limited resources. But to speak to the transitional housing, that really captures transitioning is the difficult step, and that is the challenge is to go from one state to the next and to maintain all those elements. The Department of Corrections, every time we release any inmate, which we do, hundreds in a month, each one of them has to get all their personal property back. If they have any money on their books, that has to be given to them. If they were on any type of medication while they were in our custody, we need to give them a 30-day supply to give them enough to get through until they can establish a relationship with a pharmacy operation or a new primary care physician. And we also, do our best to help that transition as much as we can. So every inmate who doesn't already have $50 to their name on their books at the Department of Corrections is given up to $50 to give them a little bit of working money to get wherever they're going. And we make sure that they have a bus ticket to get to their community that they're going to arrive in. But again, there are still obstacles and challenges for anybody in that situation to try and get established. We talk about where they're going to live and whom they're going to live with. But as my colleague has already addressed, sometimes that situation changes overnight or day to day, depending on the situation that person is trying to go back to. So those are challenges that they face. And then we try and establish a way to help them address those challenges on their way out so that they can be successful.
Imagine, Jason, somebody comes out of Department of Corrections facility where they've been getting really good mental health care, really good substance abuse treatment, primary health care, but their discharge is to Valiant, Oklahoma. I mean, where are they going to find those services? So sometimes what you will see happen is people that get discharged to small towns where those services just aren't available. No matter how much they tried to get them, they will end up in Oklahoma City or Tulsa because that's where the services are.
So it sounds like a little outreach to the rural areas to try to come up with some programs might be of benefit to those leaving incarceration and trying to get reestablished.
It's a resource issue, just as Justin said.
Yeah, we talk to our rural communities all the time about trying to establish any resources, whether it be, utility supply or anything. And the challenge is just the cost per person is so much higher in a rural community than in an urban environment. It's a difficult thing to keep and maintain over time. And of course, any level of inconsistency just adds to the challenge of clientele that are trying to utilize the services.
So the Sarah Stitt Act was passed this previous legislative session. So how does that impact helping those leaving incarceration?
So the Sarah Stitt Act did a number of things. Significantly, what it did was it authorized the Department of Corrections to work together with the Department of Public Safety to help streamline the identification and documentation process for either a state ID card or a driver's license, so that ideally all of these inmates are leaving the Department of Corrections with a valid form of photo identification. We've talked about the number of obstacles that anybody can face. All of those are made worse if someone doesn't have a valid form of photo identification. Everyone that you want to interact with, whether it be a service provider, an employer, an apartment, they all want to know who you are and they want that information validated. So if the state of Oklahoma can provide that validation to all of our inmates on their way out, that's just one more thing that they don't have to deal with as they try and reengage with all these different services that the state provides. And it's also a benefit to the state to be able to know who these people are when they travel from one community to the next.
So would a similar program for the homeless at large, would that benefit them as well, trying to get the IDs, even though they may not have been incarcerated?
Yeah, absolutely. And, we assess everybody that comes through our doors, and that's about 6,000 people a year. And one of the first questions we ask is, do you have valid, unexpired ID? And when the answer is no, and that's the first thing that we get to work on, because everything else kind of depends on that. Being able to rent an apartment, even with assistance, or being able to find work, to apply for SNAP or other government benefits. Those all depend on having ID. And just as Justin said, is a lot of the people we work with don't keep a folder of all those documents. And I can't. That's not a criticism. I don't know that I could find my birth certificate. I know it's around somewhere, but especially, if you've been living under a bridge for the last couple of years, chances are you don't have any of that source documentation. And so case managers work and discharge planners work at Department of Corrections. There's a lot of just chasing that paper down.
So could breaking this cycle of incarceration to homelessness, could it actually save taxpayer money?
Oh, absolutely. And absolutely, no doubt. So, in Oklahoma City, at least, to leave a person on the street costs the community about $18,000 a year in emergency medical and law enforcement and jail and all those costs, and homeless shelter, all that kind of stuff. And we can house an individual and pay their rent, pay their utilities, and provide them with fairly intensive case management for less than $10,000 a year. So you literally cut the cost of homelessness in half by reducing some of those barriers. And ID is a huge barrier.
Absolutely. Every citizen or every person who leaves the Department of Corrections to become a productive citizen, not only is it reducing the costs on the state, but it's also, becoming a producer and generating income and taxable dollars and things like that to help put back into the system to assist others. And so if we can reinvest in people so that they can become productive members of society, then all the better for the state, for them as an individual, and for the taxpayer at the end of the day.
For Oklahoma City, it seems like it's a fairly exciting time when it comes to addressing the issue of homelessness because of the MAPS program. And of course, the task force has just released its report. So Dan, tell us a little bit what about that report said and what the way forward is for the capital city.
Sure. So the mayor, about almost 2 years ago now, convened a task force to look at how we as a community respond to homelessness. And the task force was very diverse. There were chamber people and provider people like me, and funder people like foundations and United Way, and people experiencing homelessness. And engaged a consultant to do some outreach to the broader community to get ideas for how we could do things better. And that report now exists on the city's website. We're asking for public comment. Is really long. It's 118 pages. It's very detailed. But there is a nice executive summary and a kind of a one-page table. If you don't want to wade through 118 pages, you can just look at those. And if you have ideas, we really want to hear that, because that plan right now is in draft form. But it includes the elements that you would expect. An ounce of prevention is worth a pound of cure. So working more on prevention, building the state's capacity for appropriate discharge planning, not just from jail or prison, but from mental health institutions, from hospitals, those sorts of places where you don't want those customers to be discharged to homelessness. And then, of course, the big thing is Oklahoma City is short about 4,500 units of truly affordable housing. So MAPS 4 and the mayor's task force kind of go together to find ways to develop and fund more affordable housing.
In terms of innovation and trying to find new ways to solve these problems, one of the things that the Department of Corrections started right before COVID, unfortunately, is our reentry fare program. So one of the ways that we've decided that would be more beneficial to this population is, instead of trying to have them coordinate with everybody on the outside, we've started inviting service providers to come behind the walls, and we do what we call reentry fares, where they all are able to connect with inmates while the inmates are in prison, and the inmates don't have to try and drive all the way across their city or their community to find these services. but they can connect with those services all in one place while they're still in custody and assist in that transition further. And that's just one of the things that our staff are doing to try and make this transition easier.
Well, Justin Wolf with the Oklahoma Department of Corrections and Dan Strong with the Homeless Alliance, thank you so much for joining us this week.
My pleasure.
Thanks for having us.